Hello, I'm Dr. Dennis McKenna. I'm joined today by Paul Semeka. Paul, it's great to have you here.
Thank you, Dr. McKenna.
So for those that are not as familiar, Paul is the president and CEO of Glens Falls Hospital. Glens Falls, of course, one of the hospitals in the Albany Med Health System, and we're so pleased to have you here today. We're going to talk about things on this campus. We're going to talk about things on your campus as well.
Great.
Very good. And I think you've been here at least once or twice before.
I have, yes.
So we've done this before. Today is a Wednesday, July 31st. Paul, let's start with you. Again, you've been at Glens Falls now for a little bit of time.
Long time, almost 35 years.
35 years. You've had various different roles while you've been up there. As I said, right now, today, you're the president and the CEO of Glens Falls Hospital, but you didn't start there. So where did you start?
Yeah, my initial role was in the marketing and communications department and then migrated into some program areas. I spent a good part of my career at Glens Falls really developing the employed network of physician practices and health centers. And then eventually moved into the Chief Operating Officer role and now into the CEO role.
So having all that background, whether it be issues with employed physicians, pharmacy work, marketing, that really positions you to be able to manage the team that does all that work today.
Absolutely, yeah.
Very good. And I will say that you are also a member of the executive cabinet here. We meet at least on a weekly basis. In fact, we just finished a one-on-one meeting here before this video. And you're someone that I rely upon to help us think about the strategy and the vision for the health system. So I appreciate you being here. Paul, we're going to start with a couple things that happened on the Albany campus in the last week. The first one is what we call our white coat ceremony. This is a fun event. This happens every year. So we have medical students who come in, and they didn't do this when I was in medical school. I wish they had. It's just a wonderful event. It's a celebration of them joining the field of medicine. Mm-hmm. First-year medical students are given their white coat, which of course is symbolic for the practice of medicine, by a second-year student. This took place down on the plaza, and they were able to invite their family there as well. There was well over 1,000 people in attendance. This year's medical school class, 145 students from 25 different states. It's remarkable.
Incredible.
I talk about this a lot. Albany Med is an academic medical center with three parts: clinical care, education, research. And it's fun to be part of a campus that has an annual cycle of students coming and going. And this white coat ceremony is one of those events that reminds us every year about that important education mission.
Yeah, and for me personally, I teach as an adjunct instructor in the Clarkson University MBA program, which is part of the Leadership in Medicine track. So some of the folks who receive their white coats are former students of mine.
Students of yours.
And one of the things that's just the most fun is to walk around the campus here and see former students in their white coats and entrenched in their medical education and knowing these are the future physicians that we're helping to develop.
There's Professor Semeka, they say. And speaking of the education mission, individuals who have finished medical school go on to do what we call residency. They also rotate up through your hospital as well.
Absolutely, and we feel it's not only a privilege, but really a obligation that we provide an excellent experience for students coming from wherever, in whatever discipline, but particularly for the medical students. They need to feel welcome. They really need to feel as if we're helping them to support their clinical education, their growth, their confidence becoming a medical provider. That's what we all need in this region for the future.
Yeah, and we appreciate it. Those same first-year students also took the Hippocratic Oath for the first time, which is wonderful. Speaking of wonderful, Albany Medical Center just recently was recognized by Newsweek. This is something that we're very, very proud of. We were identified as one of the greatest workplaces for diversity, and that story is on the intranet. There was criteria that was used that looked across many different demographics and domains, and that's something that I think we speak about here as a source of pride for us as far as the diverse workforce we bring. One data point that I share every week at our new employee orientation is the fact that our workforce is made up of individuals that have over 80 different home origin birth countries, which is really something pretty remarkable. In the vein of diversity also, I would point you to a wonderful story about Kelsey O'Driscoll. She's a nurse here on this campus. She helps us with asthma education. And it's a really wonderful story, really a quite inspiring story that many people reached out to me both on this campus as well as in the community to talk about how proud they were of Kelsey and the work that she does. So congratulations to Kelsey. And Paul, I know this is an area of really significant
It is.
importance and interest to you as well as to the Glens Falls campus as well.
Yeah, and on our campus, we feel very strongly that all those who are coming to the campus, whether they're coming as a patient, as an employee, as a visitor, that everyone feels welcome and that we acknowledge and celebrate the uniquenesses and diversity that makes us who we are. One of the very specific things we're working on right now is in our legacy electronic medical record. We have flagged any important information that a patient has shared with us that can help us better care for them as they go forth on their journey with us in the hospital. We want to make sure that information is transitioned into Epic as we go forth with the Go Live, so we don't lose those nuances and those opportunities for us to make everybody feel welcome when they're coming to us on our campus.
Yeah, absolutely. It's a great example of using that technology and platform to leverage to make everybody feel more included. I know when I walk around your campus also, there's a lot of members of the workforce that wear something that says Ally, and I know that's an important project and program that happens on your campus as well.
The Ally badge is earned by taking some very specific training and education related to diversity, what it means for our patients, for our community, for our workforce. And the Ally badge is a symbol that tells everyone that they are welcome, that they're in a safe space, that they can confide in the individual. We have about a third of our workforce to date have taken that special training and proudly wear the Ally badge.
Yeah, that's special. Congratulations.
Thank you.
Let's talk about two other things that I think you're probably very proud of and should be on the Glens Falls campus. I know, and I think the community knows, that C.R. Wood Cancer and cancer care at Glens Falls Hospital is very special. And recently there was some important Commission on Cancer survey information that you want to share with the group.
Yeah, recently we underwent our triennial, very comprehensive survey by the American College of Surgeons Commissions on Cancer, which accredits cancer programs. They look at every aspect of the program, from clinical care to everything that supports the patients during their cancer journey. They really want to make sure that you understand and you demonstrate an ability to recognize the entire experience that a cancer patient goes through, including transitioning to survivorship and long-term care and recommendations for continued treatment and surveillance. We were very proud, and for us, the ultimate statement, endorsement that we look towards is that at the end of the surveyor said to us that he would be happy for him or any member of his family to receive care at the C.R. Wood Cancer Center, and we're thrilled to hear that.
That is wonderful. Another thing that I know that you're very proud of is the magnet status for your nurses as well, and that's something that a few years ago you were recognized for. I know you're going through the process again of looking for magnet certification.
Yeah, we are up for recertification. Our document is due in early 2025, so we're beginning that compilation. You really have to put together lots of evidence to show how Magnet has really supported the organization in comprehensive integrated care with all caregivers. Even though it's a nursing designation, it really speaks to the model of care within the organization and the engagement of staff at all levels. We're particularly proud of that, and we're really thrilled to be able to put together this document in anticipation of our recertification process next year.
Congratulations.
Thank you.
Congratulations. And let's finish on a topic that obviously is of particular interest to me, no surprise, which is emergency medicine, emergency departments. They are often described correctly, I think, as the front door to the hospital. They never close. They're always open. They take care of everything from minor to severe, obviously, pediatric and adult and everything in between. The faculty who work in the emergency department at Glens Falls Hospital as emergency medicine attendings and advanced practice providers are on the faculty here at Albany Med.
They are.
Many of the providers often will move back and forth between the campuses. It's an incredible emergency department up there with great care to individuals in the North Country. But like most emergency departments these days, you find yourself saying, I wish we had more space because more people are coming in and they need to be managed in an environment that has both staff and space to do it. And you're going to do something about that.
Yeah, we're working on a project right now. In fact, we have an application before the Department of Health for approval to move forth with a renovation and a small expansion on our current emergency department. We see about 44,000 patients a year, some of that compressed in the summertime due to our tourist population. But we also know that our volume is increasing as our population, particularly in the North Country, continues to age. So we really need to have a more efficient, a more appropriate a true diagnostic center for those coming into the department. And our facility, which was last touched back in the 90s,
Right.
it just isn't meeting those needs. So while we know today we deliver great clinical care and we're really proud of our provider team, many of whom actually are graduates of,
That's right.
of Albany Medical
They sure are.
College, we know we need to give them a better space in which to provide services. So later this year we'll be announcing that project and hopefully begin construction, which would be pretty good.
Yeah, well, we look forward to it. It's absolutely, as you described, something that I think will take great care, but even take it to another level. We should do this more often. You made this
Love
too
to.
easy for me.
It's my old marketing days.
That's right.
Way back when.
We could change seats next time. All right, Paul, it's great having you here.
Thank
We
you.
really appreciate it.
Happy to be here.
Congratulations on all the great successes up at Glens Falls Hospital, and we continue to obviously work together and see what we can do as a system. So thanks
Sounds
for being
great.
here.
Great, thank you.
Obviously, as I've said in previous videos, we appreciate you now more than ever, especially those of you that are working nights and weekends and coming in over these very, very busy summer days. We look forward to talking to you again in about 2 weeks' time. We ask that you once again please take care of yourself, take care of each other, and we'll see you in about 2 weeks.